With the practitioner and the patient sitting at the same level, the waterproof shoulder cape is applied around the patient's neck to ensure they will be kept dry from water and debris. The practitioner uses the headlight to ensure full visibility of the ear canal while the irrigation procedure is being performed. Using tap water and ensuring the temperature is at 40 degrees Celsius, after 20 seconds of running the tap water, approximately 700 ml of the warm water is inserted into the reservoir. The practitioner pours water onto their finger to ensure the water is warm enough for the procedure to be performed. A new single-use QRX tip is removed from the packaging, the collar is pushed back, and the tip is securely held in place when the collar is released. The machine is turned on and the pressure control set to minimum setting. Using the foot pedal to start the flow of water, the practitioner and the patient, using their finger, ensure they are comfortable with the temperature of water and the noise of the machine. The patient is asked to sit sideways on the chair so they can lean on the chair to be able to comfortably hold the newt tank in place under the earlobe. Always using the headlight to aid the visibility of the ear canal, the practitioner holds the irrigation handle across the palm of their hand and they introduce it to the entrance of the ear canal. After irrigating the ear for 10 seconds, the practitioner stops and questions the patient that they remain comfortable and do not feel any water at the back of the nose or throat. As the patient is comfortable, the practitioner continues the procedure, straightening the ear canal by holding the pinna up and out. With the handle pressed against the tragus and water flowing along the posterior wall of the ear canal, irrigation is continued. Using the headlight, the practitioner sees that the wax is coming towards the entrance of the ear canal and they will now be able to appropriately use the wax scoop to remove the wax. Using a tissue to dry the entrance of the ear canal, the practitioner removes a new disposable scoop from the bag. Straightening the ear canal and with the headlight for visibility, the wax scoop is inserted into the ear canal and the wax is removed. This has reduced the length of the irrigation procedure and also improves patient comfort. Drying the entrance of the ear canal, the practitioner will now need to perform oral toilet to remove all the water from the ear canal. Using cotton wool approximately the size of a postage stamp, the nurse teases the cotton wool apart and inserts the serrated end of the wax scoop onto the cotton wool. Once the cotton wool has been tightly mounted on the serrated end of the wax scoop, it is inserted to the entrance of the ear canal and using a gentle rotary motion of the scoop, water left pooling within the ear canal will be absorbed back by the cotton wool. Once the cotton wool is wet, it should be discarded from the scoop and the practitioner is re-examining the ear to ensure all the water has been removed from the ear canal. There is no wax or debris left within the ear canal and the patient has a normal tympanic membrane or eardrum. The result of this procedure will be documented according to professional guidelines. The trained practitioner is then advising the patient on how to take care of their ears. They will be advised to keep their ears dry from the entry of water for a minimum of 5 days after irrigation. In order to do this, they can use a small amount of cotton wool which has been coated in petroleum jelly, and this should be inserted at the entrance of the ear canal. This will help to protect the ears from any entry of water. The patient will be advised not to insert any implement in their ear which could cause damage to the ear canal or eardrum. The patient is also recommended to attend a trained practitioner for ear care and a further ear examination in approximately 1 year. Any further wax build-up can be removed before it becomes a problem for the patient. The patient is also given written guidelines on how to take care of their ears, and this full procedure will be documented according to professional guidelines.